Today, let us discuss about the clinical picture of labor and stages of labor.
In clinical view, what are the stages that takes place in the woman who is in the labor? The first stage is the prodromal stage. The first stage is called as prodromal stage or pre-labor stage. Pre-labor, before delivery, what happens in the mother's body? First one is shelving. Shelving is nothing but what happens in the pregnant lady. The abdomen, the fundus of the uterus comes down because the baby is engaged. Because of the baby is engaged or because of the baby comes down. So what is happening? The fundus of the uterus comes down. By that and comes down and forward. Comes down and forward. By that it is just like a shelf-like appearance in between the mother's fundus and the upper part of the body. So that is called as shelving. Shelving is nothing but the gap, the wide gap formation above the uterine fundus because the uterus, the fundus of the uterus comes forward and downward. Comes forward and downward, making a shelf in between the diaphragm and above the fundal uterus. And next one is lightening. Lightening, when the fundus is coming forward and downward, what is happening? There is a relief pressure, right? The pressure on the abdomen or the pressure on the bowel and the pressure on the lungs is relieved. So the patient labored mother is feeling that lightening. Means why? She don't have dyspnea and she doesn't have dysphagia. What do you mean by dyspnea? Difficulty in breathing. Dysphagia means difficulty swallowing. Why actually these symptoms are present? Because the fundus of the uterus is keeping pressure on the diaphragm of the mother and also abdominal cavity. When the uterus or when the fundus of the uterus is downward and forward, the pressure on the lungs and the pressure on the abdominal cavity is less, right? So that is the reason she feels lightening. Next one is pelvic pressure. Obviously, when the fetus is coming down, the pelvic floor pressure is more, right? The pelvic floor pressure is more. Why? The fetal head is coming down. The uterine content is coming down in the process of delivery. So, what all the pelvic organs are present? Bladder, rectum. So, mother feels that something is coming from vagina and also she also feels the rectal pressure in this pelvic floor pressure. Rectal pressure is present and frequent maturation is present because pressure is lying on the rectum as well as on the bladder. So frequent maturation and rectal pressure is present due to the pelvic floor pressure is more. Next one is increased vaginal discharge. Vaginal discharge gets increased because of the more mucus is produced and because of the show presentation. So this vaginal discharge gets increased to facilitate the movement of the baby in the pathway. Vaginal discharge increases. And another is false labor pain. What do you mean by false labor pain? False labor pain takes place before the true labor pains comes. False labor pains are less strengthened than the true labor pains. False labor pains are not stronger enough to dilate the cervix. That is the reason these are called as false labor pains. The false labor pains are not strong enough in the dilatation of the cervix. and the concentration or the intensity of the labor pains are less, very mild. So that is the reason these are called as false labor pains. False labor pains comes beforehand or beforehand of true labor pains. These are all the signs of the prodromal stings. What are they? Shelfing, lightening, pelvic pressure increase and increased vaginal discharge and appearance of false labor pains. Next stage is onset of labor. Onset of labor, again there are 4 stages. What are they? True labor pains. True labor pains means the contractions and relaxation of uterus starts, and the true labor pains starts with a strong contractions of the uterus. The true labor pain starts with the strong contractions of the uterus and strong contractions of the abdominal muscles also. And show presentation. Show is nothing but the blood-stained mucus passes through the vaginal cavity. So, show is nothing but blood-stained mucus. The blood-stained mucus from the vagina is called as show. That it indicates the mother is in true labor. And cervical dilatation. The cervix start to dilate from 1 centimeter to 10 centimeters. Presence of the bag of forewater. This is called as forewater. Once the cervix is fully dilated, then the amniotic fluid forms a bag in between the cervix and the head. Pouch of the bag that filled with the amniotic fluid, that is called as forewater. That means the mother is completely dilated and the forewater comes out and the mother is ready to deliver the baby. These are all the 4 sub-stages of the onset of the labor. What are they? True labor pains, the show presentation, presence and the cervical dilatation and presence of the bag of water with the forewater. Now let us see the physiological effects of labor. Physiological effects of labor on mother and fetus we can observe. What may be the physiological effects? If we see here, stage wise on the mother, there are many effects takes place on the mother. The first stage, during the first stage, the effects of labor on the mother is minimal, because it is just like the contractions and relaxations of the uterus. And whereas the second stage, delivery of the baby is the second stage. So during the second stage, the pulse rate increases because she is giving the bearing down efforts and she is more painful. This is the more painful stage. So pulse rate increases 10 beats per minute, 100 beats per minute, and blood pressure also increases, mainly systolic blood pressure, because of the anxiety and pressure of the delivery. The mother's blood pressure, systolic pressure may increase minimally. And conjunctival edema increases because why? The blood circulation to this place is increased. And the stage 3, what is the stage 3? The placental expulsion is called as stage 3. Next we are going to discuss about the stages of the labor. We will see in detail. So stage 3. During the stage 3, placenta is expelled. The placenta is separated and expelled out. What is happening? The sinuses which are there, the large blood vessels which are there underneath the placenta doesn't contract immediately. Before contraction, it loses some amount of blood, nearly 100 to 200 ml of blood. 100 to 200 ml of blood. And besides that, we are giving episiotomy. We are giving episiotomy to prevent the perineal tear. From this site also furthermore 100 ml of blood loss will be there. So nearly 300 to 350 ml of blood loss we can see in the normal labor during the third stage. During the third stage. These are all the physiological effects on the mother during the labor. The first stage, the effects are minimal. Second stage, pulse rate increases and blood pressure increases and conjunctival edema presents. Third stage, blood loss presents, maybe like 300 to 350 ml of blood loss presents. Okay, physiological effects of labor on fetus. What only one effect is there on the fetus? What is that? Molding. Molding is nothing but overlapping of fetal sutures one on the other to reduce the size of the head to pass through the passage of the maternal genitals. Why? To facilitate the normal delivery. So, but it should be minimal. It should be minimal molding. If it is over molding, what happens? If it is over molding, the over molding of the sutures can cause intracranial hemorrhage. Intracranial hemorrhage. If molding takes place overly because of the contracted pelvis, if the mother's pelvis is lesser to passage of the baby's head, if the baby's head is molded very highly, there is a chances of intracranial hemorrhage because the intracranial pressure may increase. If the molding is minimal to it's normal, there is no problem. Normal delivery can happen. If the molding is over, it can cause intracranial hemorrhage. Next one is stages of labor. How many stages are there? 4 stages are there. Stage 1, stage 2, stage 3 and stage 4. The first stage is also called as cervical dilatation. Cervical dilatation. Here, the first stage is called as cervical dilatation. This first stage starts from true labor pains. The starts with the true labor pains and ends with the full dilatation of the cervix. That is 10 centimeters dilatation of the cervix. The first stage is also called as cervical dilatation stage. This stage starts with the true labor pains and ends with the full dilatation of the cervix. Full dilatation of the cervix. So, these are facilitated by the uterine contractions. When the uterine contractions are enough to dilate the cervix, then the cervix can dilate. Uterine contractions present and abdominal muscles. Even abdominal muscle contractions also present during this stage. In first stage, again 3 sub-stages are there. The first one is latent phase. Second one, active phase. Third one, transitional phase. First stage of labor again having 3 sub-phases. They are latent, active and transitional. Latent phase starts from true labor pains. And ends with a 4 centimeter dilatation. 4 centimeter dilatation. Latent phase. And active phase starts from 4 centimeter dilatation to 8 centimeters dilatation. 8 centimeters dilatation. Transitional phase is nothing but the period between first stage of labor to the second stage of labor. This period is called as transitional period. This starts from 8 centimeters of dilatation to the 10 centimeters cervical dilatation. 10 centimeters of cervical dilatation. Here, what I want to mention here, latent phase. It's starting from true labor pains to 4 centimeters. In primigravida, those who are conceived for the first time, it takes 8 hours. It takes 8 hours time, latent phase. Whereas in multipara or multiple times she gave birth to the baby, there takes only 4 hours. 4 hours. Primigravida. Primigravida means those who are first time pregnancy. The latent phase, cervical opening of the 4 centimeters takes 8 hours time. 8 hours time. Whereas multipara means she is multiple times she gave birth. She only takes 4 hours to dilate 4 centimeters. Next one, active phase, 4 centimeters dilatation to 8 centimeters dilatation. So, in this primigravida, takes 4 hours. 4 hours time. Whereas multipara takes only 2 hours. 2 hours. During this stage, for every hour 1.2 centimeters dilatation takes place. For every hour. In active phase, for every 1 hour, a mother should dilate 1.2 centimeters. In multipara, she should dilate 1.5 centimeters dilatation. If it is less than 1 centimeter dilatation per hour in this active phase, then the pregnancy is called as, then the delivery is called as prolonged labor. Prolonged labor. If in the active phase, the cervical dilatation is less than the 1 centimeters per hour. If we wait for 1 hour in this stage, the cervical dilatation is less than the 1 centimeter, called as prolonged labor. If it is more than 1 centimeters, like 1.2 centimeters in primigravida, that's okay. If it is 1.5 centimeters in multipara, then it is normal. So during this stage, the cervical dilatation should reach 8 centimeters. Next one is transitional phase. The transitional phase is nothing but the gap between the first stage of labor and the second stage of labor is called as transitional phase. In this phase, it starts from 8 centimeters cervical dilatation to the full cervical dilatation, 10 centimeters dilatation. And in this phase, mother feels very like urge to push down or bear down efforts. Bear down efforts. And it takes 1 hour in primigravida and half an hour in multipara. In case if it extends more than 2 hours, in primigravida, it is called as prolonged labor. If it extends 1 hour in multipara, that is called as prolonged labor. Prolonged labor. Stage 2, fetal delivery. Stage 2 labor is also called as fetal delivery. It starts from the full dilatation of the cervix and ends with the fetal delivery. Second stage starts with full dilatation of the cervix, that is 10 centimeters, and ends with the fetal delivery. It's called as stage 2. Stage 2. the delivery of the fetus. Can fetus deliver just like that? No. There are multiple movements that takes place on the head and body of the fetus. Multiple movements that takes place in the fetal head and the body of the fetus. That I will discuss with you later after explanation of the 4 stages of labor. And the third stage is known as placental delivery. Once the fetus is delivered, then the placenta has to be expelled. Placental delivery or placental expellation is called as stage 3. Stage 3 starts from delivery of the fetus. Stage 3 starts from fetal delivery and ends with the placental expulsion. Ends with the placental expulsion. Stage 3 in the labor starts with the delivery of the fetus and ends with the expulsion of placenta. And here 350 ml of the blood loss presents. Next one is stage 4. Stage 4 also called as observational stage. After delivery, after cleaning the mother, and we keep her on observation for 2 to 4 hours. Or after delivery few hours, we will keep the mother on observation. What exactly we have to observe the mother? Vaginal bleeding. We are observing for any PPH. What do you mean by PPH? Postpartum hemorrhage. Postpartum hemorrhage we'll have to check here. But we'll have to check if the 50 ml or 20 ml after the delivery, that is okay. If it is like she is bleeding profusely, that means some abnormality is there. We'll have to check for any abnormal bleedings are there or any postpartum hemorrhage are present. And we should massage the uterus manually from the above the abdomen. Why we will have to every 15 minutes you have to massage the uterus manually to make sure that the uterus goes to the normal position. Normal position means after the delivery, the uterus goes to the 12 weeks gestation. 12 weeks gestation is just above the symphysis pubis in the size of cricket ball. In the size of cricket ball, the mother's uterus should be reached after delivery. If it is not reached, if it is flabby, what do you mean by flabby? Soft. So that we can know that some abnormal bleeding is there or some abnormal tonicity is there in the uterus. To check these all the things, we will keep the mother in observational stage, that is called as stage 4. We will be observing the mother for any postpartum hemorrhage or any uterine abnormal tonicity is there. Then take the treatment measures to avoid any complications. Right? So, these are all the stages of pregnancy, labor. What are they? First stage is also known as cervical dilatation stage. Second stage is also known as fetal delivery. Third stage is also known as placental expulsion or delivery. Fourth stage is known as observational stage.